Dr. Joseph Paturi, President of the Global Grace Health, Dr. Alok Agrawal, Mr. Daniel Rajaya, other members of the Global Grace Health and Grace Cancer Foundation. A very good morning and namaskar from New York. Like I said, this is a real honor to be part of such a distinguished gathering. And I spent some time to go through the website of both Global Grace Health and the Grace Cancer Foundation. And I must say, it has been quite impactful journey that you have made. Global Grace Health in last 4 years, and even the Grace Cancer Foundation. I saw their work in Sierra Leone to other parts of the world and in India. That of course includes my home state, Odisha. Truly impactful work and very impressive journey that you have made in a very short time. And I'm sure the credit goes to all the members who are dedicated in a dedicated way working for this cause. In your website, I also, saw the objective, and I particularly liked a particular sentence that you have mentioned. Your objective being to provide care and compassion with commitment in reaching the unreached. So that's something, very powerful statement. And like I said, I saw your work in the website about what you are doing. So truly my compliments to you all. I have spent about a year now in United States. I am familiar about the great work that Indian uh, doctors, Indian caregivers, Indian nurses are doing in this country. Recently, we launched a report of Boston Consultancy Group that was on the impact of Indian diaspora is making in United States. And there I came across the statistics about Indian doctors. So while we are 10% of the total of American doctors, but we are treating about 30% of the patients here in this country. And similar is the story about Indian medicine in generic and other segments. And I think equally impactful is the story of Indian nurses, Indian caregivers. I would say this set of people, Indian doctors, they are the true soft power that India has in this country. They are reaching a lot of people in the mainstream United States, and they are bringing India close to their heart and creating a lot of goodwill for India in the mainstream United States. Coming to India, there also the landscape is changing. You all are working in India in both direct and indirect ways. But I'm sure you are also familiar with the positive developments in India, for example, the Ayushman Bharat, which is providing health insurance now to about 500 million people. John also the Kendras, which are providing very affordable medicine to people. And in fact, last week I did my annual health checkup, and I found that 250 rupees medicine from India is costing $500 here. The same ointment, So I was rather, kind of not so happy to see that Indian medicine, which are so affordable in India at $3, are costing $500 here. But I think the things in India are kind of looking positive. The change in the mindset of our society, our people, is also quite commendable. You see the sense of hygiene. Recently, we concluded Kumbh Mela with participation of about 55 crore people, 550 million people. And recently, we did a program here where the focus of the speakers from Harvard Business School was on the Swachh Kumbh that was organized in India. So I would say, the society's mindset is also changing towards, better hygiene, better healthcare in the country. And now, if you ask me as to what is it I would expect from such a distinguished gathering like yours, I would say two things. Like I mentioned about the Indian diaspora, I, as Indian Consul General here, I deal with 2.4 million strong Indian diaspora in the 10 states of the Northeast. And during my interaction with Indian diaspora, during even the report that we came out with from the BCG, we came across the statistics, which is quite worrisome. That's about 6% of Indian diaspora in the United States are belonging to below poverty line category. So it's not that entire Indian diaspora in this country is in the prosperous category. So there are 6% people which are largely women. They require our attention, and good hearted people like you, I'm sure, should also keep them in your priority list. And the second is about India. You all are doing commendable work in India, But if you ask me what India needs from such a distinguished, diaspora that we have in this country, in one word, I would say technology. Uh, I came across very, very distinguished people in my last 1 year here. I was in MIT, met a professor, Pramod Sinha. He is providing neurological solution to children who are born blind in India, but now, thanks to neurological interventions, they can have eyesights now. And in last 2, 3 years, they have given eyesight to more than 600 such children who were born blind, but now they can see the world. So that's the role of technology, which can bring such life-changing experiences to Indian kids. What you are doing in terms of cancer screening is equally impactful. What we need is such technological interventions into far-flung places where while the government intervention has been there, but I think the best of the technology from United States through people like you can make a big change. I would conclude by again expressing my compliments, my congratulations, that in last 4 years you really have had an impactful and impressive journey. We as a consulate, if we can be of any assistance, any support, we'll be more than happy to do that. Like I said, we really, really feel grateful that we have such a distinguished community and such a distinguished set of people who are working around the world with focus on India. So my sincere thanks to Dr. Joseph Paturi and the entire team of Global Grace Health again for organizing this event and also inviting me to such a great gathering. Thank you so much.